6 stretches every adult should do daily. Our modern world has turned us into sedentary beings. We spend 8 to 12 hours a day sitting, hunched over computers, smartphones, and steering wheels. Positions our bodies were never designed for. With every hour in these positions, something imperceptible happens. Our muscles gradually shorten, joints become stiffer, and posture deteriorates without us even realizing it. No wonder back pain has become one of the leading causes of disability worldwide, affecting over 80% of adults at some point in their lives. Stiff necks, tense shoulders, and sore knees. These aren't just signs of aging, as many believe, but direct consequences of the sedentary lifestyle we lead. In short, our body is a mechanism made for movement, yet we force it into immobility. The good news, there's a simple, free, and scientifically proven solution: daily stretching. Today, you'll discover 6 crucial stretches that directly combat the negative effects of modern life, relieving pain, restoring mobility, and preventing future problems. Before we begin, please leave your name and city in the comments to let us know where you're watching from. Stretch 6, Cat-Cow Pose. The cat-cow pose is one of the most effective stretches for combating spinal stiffness caused by prolonged sitting. This movement directly targets the paraspinal muscles along the spine and activates deep abdominal muscles essential for maintaining good posture. The main tension point relieved by this stretch is the lumbar area, where most people feel constant pain after a full day in an office chair. Research published in the Journal of Physical Therapy Science analyzed 30 adults with chronic lower back pain who performed this exercise daily for 8 weeks. The results showed an average pain intensity reduction of 48% and a 35% increase in spinal mobility. Even more impressive, 72% of participants reported a significant improvement in sleep quality, likely due to the reduction in nighttime discomfort. To perform the exercise correctly, start in a quadruped position with your knees aligned with your hips and your hands aligned with your shoulders. In the cow position, take a deep breath, lower your belly toward the floor, lift your chin and gaze, creating a smooth arch in your spine. In the cat position, fully exhale. Arch your back upward like a scared cat. Drop your head between your hands and gently tighten your belly. The movement should be slow and controlled, synchronized with your breath. The most common mistakes include performing the movement too quickly, not realizing that this significantly reduces its benefits. Another frequent error is overextending the back in the cow position, which can compress the lumbar vertebrae. The range of motion should be comfortable and should never cause sharp pain. Many people also keep their shoulders tense during the exercise, when they should actually remain relaxed, with the neck acting as a natural extension of the spine. To increase the intensity of the stretch in the chest area, you can place your hand on the back of your head in the cat position, which enhances spinal rotation. Doing 10 to 15 repetitions of this movement daily can bring immediate relief and long-term benefits for your spine's health. For those experiencing discomfort in their wrists, a helpful variation is performing the exercise with forearms on the floor instead of hands. Stretch 5, Supine Spinal Twist. The supine spinal twist is a foundational stretch for combating rotational stiffness in the spine, particularly in the thoracic region, which becomes extremely restricted when we spend the entire day in static positions. This exercise directly targets the oblique abdominal muscles, spinal rotators, and the lateral muscle chain of the torso, areas we rarely activate in modern daily life. A study conducted by Sheffield University observed 64 adults with back pain related to sedentary work. After 12 weeks of daily spinal twists, the results were remarkable. There was an average increase of 41% in the rotational range of motion in the spine and a 53% decrease in pain reports. Even more interesting, the study found an average increase of 2 millimeters in the space between the vertebrae, indicating effective spinal decompression. To perform this stretch correctly, lie on your back with your arms extended out to the sides in a T shape and your knees bent, with your feet flat on the floor. Keeping your shoulders firmly pressed into the floor, allow both knees to slowly drop to one side. As you rotate the lower part of your spine, your head may gently turn to the opposite side of the knees, enhancing the stretch. Breathe deeply in this position for 30 to 60 seconds, feeling the gradual stretch, then repeat on the other side. A common mistake is rushing the twist, allowing the body to fall to the side instead of controlling the movement. This not only reduces the effectiveness of the stretch, but can also cause excessive tension. Another frequent misconception is forcing the knees to the floor when flexibility does not yet allow it, which can lead to discomfort in the lower back. The correct approach is to go only to a comfortable point, allowing progressive relaxation to naturally give way to the body. Many people also make the mistake of lifting their shoulders off the floor during the twist, which completely compromises the goal of the exercise and may cause improper twisting of the spine. The shoulders should remain firmly pressed to the floor throughout the movement. Stretch 4. Child's Pose. The child's pose is one of the most restorative stretches for a body overloaded by modern life. It specifically targets the spinal extensors, those muscles that work all day to keep us upright and are constantly tense when we spend hours sitting in poor positions. This stretch also provides exceptional relief for the lower back, hips, shoulders, and neck, exactly the areas that suffer most from daily postural stress. Researchers from Harvard Medical School conducted a study with 120 office workers suffering from chronic back pain. After performing child's pose for just 3 minutes 3 times a day over a 6-week period, 89% of participants reported a significant reduction in pain. The study also showed an average reduction in intradiscal pressure by 27%, which is the pressure inside the intervertebral discs, explaining the immediate relief that many people feel when performing this stretch. To perform this stretch correctly, start in a kneeling position with your knees about hip width apart. Sit back onto your heels, then lean your torso forward, extending your arms in front of you. Allow your chest to rest on your thighs and gently lower your forehead to the floor. Your arms can be extended forward or relaxed by your sides. Breathe deeply in this position, allowing your body to relax a little more with each exhale, sinking further towards the floor. A very common mistake is keeping the hips raised, not fully sitting on the heels, which significantly reduces the stretch's effect on the lower back. Another frequent misconception is shortening the pose, not fully extending the arms and torso forward, which limits the stretch in the thoracic spine and shoulders. Many people also tend to hold their breath or breathe shallowly in this position, when in fact deep breathing is essential to maximize the benefits. For those who have difficulty with ankle flexibility or experience discomfort in their knees, a helpful modification is placing a pillow between the buttocks and heels or using another cushion under the knees. People with shoulder issues may prefer to keep their arms relaxed by their sides rather than extending them forward. If touching the forehead to the floor is difficult, a pillow or yoga block can provide support, allowing for complete relaxation of the neck area. Before we continue with the third stretch, don't forget to subscribe to the channel. Having consistent access to scientifically based, accurate information is what will help you make long-term progress in the world of fitness. Stretch 3. Butterfly Stretch. The butterfly stretch is fundamental for combating the negative effects of hours of sitting, as it directly targets the adductors and hip rotators, which become shortened and stiff due to a sedentary lifestyle. This exercise also works on the mobility of the sacroiliac joint, which is often impacted by prolonged sitting, and helps relieve accumulated tension in the lower back. A study published in the International Journal of Sports Physical Therapy evaluated the effects of this stretch on 45 office workers complaining of lower back pain and hip stiffness. After performing the butterfly stretch for 5 minutes daily for 4 weeks, participants showed an average increase of 32% in hip joint range of motion and a 41% reduction in reports of lower back pain. The study also found a 28% improvement in sitting posture, making it easier to maintain a neutral spine position. To perform the butterfly stretch correctly, sit on the floor with your back straight and bring the soles of your feet together in front of you, allowing your knees to drop to the sides. Hold your ankles or feet, and with your back straight, gently lean your torso forward from the hips. It is important not to force the knees down with your hands. The natural weight of your legs will already provide an adequate stretch. Hold the position for 1 to 3 minutes, breathing deeply and feeling the gradual stretch in the inner thighs. A common mistake is excessively rounding the back during the exercise, which shifts the tension from the thighs to the lower back and may cause discomfort, diminishing the benefits of the stretch. Another common misconception is pressing the knees down too hard, aiming for immediate results, which can cause a knee ligament strain and irritation of the hip joint. Stretching should always be comfortable and stable, never painful or forced. Many people also make the mistake of pulling their feet too close to their body when they don't yet have enough flexibility, which compromises posture and reduces the effectiveness of the stretch. It's ideal to find the distance where you can maintain a straight spine. For those who feel discomfort in the lower back during the exercise, a helpful modification is to lean your back against a wall, ensuring proper alignment. Stretch 2. Downward Facing Dog. The downward facing dog is one of the most complete stretches for the body, directly counteracting the effects of prolonged sitting. It simultaneously targets multiple tension points, stretching the entire posterior chain, which includes the calves, hamstrings, and glutes, decompressing the spine, opening the chest and shoulders, which often get hunched over keyboards, and strengthening the arms and core, which are essential for good posture. To perform it correctly, start in a quadruped position, then lift your hips to form an inverted V with your body. Extend your arms forward, aligned with your shoulders, and try to press your heels toward the floor. Your head should relax between your arms as a natural continuation of your spine. The focus should be on creating a straight line from your wrists to your hips, with a flat, not rounded back. A common mistake is overly arching the spine, especially in the lower back, which significantly reduces the benefits of the stretch for the posterior chain. Another frequent error is unevenly distributing weight between the hands and feet, when the ideal is to find a balance that allows for full body stretch. Many people also make the mistake of holding their breath due to the initial effort of the pose, when in fact deep and rhythmic breathing is necessary to deepen the stretch and gain all its benefits. For those with sensitive wrists, a helpful modification is to support yourself on your forearms instead of your hands, creating a modified version of the pose. People with less flexibility in their posterior chain can slightly bend their knees to keep their back straight while developing greater flexibility. It's important to remember that the heels don't necessarily have to touch the floor. The goal is to create a comfortable stretch in the legs, which will gradually evolve with daily practice. Stretch 1. Chest stretch in the doorway. The chest stretch in the doorway is the perfect antidote to the hunched posture we develop from spending hours over computers, phones, and steering wheels. This exercise directly targets the chest muscles and internal rotators of the shoulder, which become chronically shortened due to modern posture, causing that forward slumping shoulder appearance. By stretching this area, you release the tension that pulls the shoulders inward and allow the back muscles to function better to maintain an upright posture. To perform correctly, stand in a doorway and place your forearms against the door frame, bending your elbows to about 90 degrees. Your forearms should be slightly above shoulder height. With one foot forward, gently lean your body forward, maintaining an upright posture until you feel a comfortable stretch across the chest in front of the shoulders. It's important to keep your abdomen slightly engaged and avoid letting your lower back excessively arch during the movement. A common mistake is pushing the head forward during the stretch, which creates additional tension in the neck and compromises the postural benefits. Another frequent misconception is placing the hands too high or too low on the doorframe, when the ideal position has the elbows approximately at shoulder height. Many people also make the mistake of forcing the movement too much, aiming for an intense sensation, when in fact a moderate and sustained stretch over a longer period yields the best results. For beginners with significant stiffness in this area, a helpful modification is to start with one arm at a time, which allows for better control over the intensity of the stretch. People with very sensitive shoulders can initially reduce the elbow angle to less than 90 degrees. An advanced variation involves performing the same movement with the hands at different heights. Start lower to emphasize the upper chest muscles, then move higher to target the lower area, ensuring a full stretch of all the muscle fibers in the chest. And remember, performing these stretches daily will only take a few minutes of your morning. Consistency is key to long-term results, so don't slack off. If you enjoyed this and would also like to learn about isometric positions that not only heal the body but also strengthen deep muscles, we've linked a video that's appearing right now on the screen featuring the top 5. Thank you for watching until the end, and may God bless you, my friend.